So we can go ahead and get started. Welcome to Balance's webinar titled Bringing the Body Back into Recovery, Dance Movement Therapy and Eating Disorder Treatment. Thank you all so much for logging on tonight and for taking the time to learn more about dance movement therapy and its use in eating disorder treatment. If you have any questions throughout the presentation, you can feel free to drop them right in the Q&A function, which will be at the bottom of your window. Our presenters will be answering questions towards the end of the webinar. And there will be a recording of the webinar sent out tomorrow to everyone who RSVP'd as well. So now I'd like to introduce you to our wonderful presenters tonight. So first we have Danielle Levitine, who is the admissions director here at Balance. She's a board certified dance movement therapist, a licensed creative arts therapist, as well as a certified eating disorder creative arts therapist. She'll be joined tonight by Aliesha Bryan, who is Balance's dance movement therapy intern and a Master of Science candidate in dance movement therapy at Sarah Lawerence College. And finally, we are so excited to be joined tonight by our guest presenter, Jennifer Sterling. Jennifer is a registered dance movement therapist, somatic experiencing practitioner, and a licensed creative arts therapist. You are all in very good hands to learn all about this topic tonight. So I'll go ahead and send it over to our presenters now. And just as a reminder, any questions can be put right in the Q&A function at the bottom, and we will be sure to answer as many as we can at the end of our presentation. All right, over to you all.
Thank you so much, Chloe, for those introductions, and welcome to everyone who's joining us this evening or morning or afternoon, depending on where you are in the world. So just a big welcome to Bringing the Body Back into Recovery, Dance Movement Therapy and Eating Disorder Treatment. During this webinar, we'll be exploring the development of the relationship to the body through the lens of eating disorder treatment. So myself and my co-host would like to begin this webinar with a bit of a reflection and an experiential. Another word for experiential could be an involving, as we'll be asking you to involve your body and your senses. So I imagine that everyone is sitting in a chair at this moment, and we're just going to utilize that. So I'll ask everyone to ensure that they have their feet flat on the ground. Allow the back of your chair to support your back. And we'll bring the palms of the hands on top of the thighs. And we'll start with some breathing. If you feel comfortable, you can bring your eyes to a complete close, or you can bring them to a soft gaze, looking maybe at the ground a couple of feet in front of you. We'll start by inhaling on the count of 3. And we'll try to exhale to a count of 6. And this is asking us to regulate the intake and the expulsion of air and ensure that we're exhaling completely. And we ask that you start to notice already any feelings that might be arising in the body, maybe restlessness or tension, lightness or heaviness. Let's bring our attention to the head and the face and just notice if there's any tension in the muscles of the face. And use the exhalation to relax any tension away. Allow any sounds from your environment to be a part of your experience. And just notice. Notice which parts of your body are touching the chair. Notice your feet on the floor. And let's start to consider this question. What challenges or barriers might prevent you from connecting with your body? Let's ask ourselves if there's a part of the body that feels neutral and what that might be. So keeping the eyes closed or in a soft gaze, Let's start to connect with that neutral part of the body. I'll be using my hands. And let's take a moment to observe the sensations in that body part. Maybe you'll touch it. Maybe you'll use it to touch objects that are situated around you. Allow that body part to interact with your environment. And on your next exhalation, come back to a place of stillness. Let's gently open the eyes and again allow the environment around us to come back into our experience. And try and stay with the experience of the body as we transition into the next slide. Here we can take a moment to, if you wish, enter some of the thoughts that arose into the chat, or you can hold on to that knowledge for yourself if you choose. And then I'll pass it on to Jennifer to talk a bit more about some of the thoughts that may have arisen.
So often as we are exploring the body, whether we're exploring an eating disorder treatment or in some other capacity, there are barriers and resistance that come up around connecting to the body. And so we often ask clients and patients, what's coming up as they try to connect? What thoughts or feelings are you having around that? Some of the things that tend to come up most frequently are feeling or saying I'm fat or I'm ugly or I'm defective in some way, perceiving the body as broken or not quite right. And so perhaps you may have also noticed some resistance, those thoughts or similar thoughts as you were exploring. And so if that is something that came up for you, to perhaps ask yourself, where are those messages coming from? And as you're hearing that voice within you, is that your own voice? Is that a more societal voice? Is that a familial voice? What is there for you? And also noticing if there's anything that you are willing to do differently to help you to feel differently about some of those barriers or feelings of resistance that came up. Is there anything that might change your experience around being in your body in any capacity?
So we very intentionally started this webinar with doing an experiential to connect to our body, to kind of be aware of the barriers that are coming up and also highlight how difficult this work can be, whether you're a clinician on this webinar today or whether you're a client. We know that this work can be hard, but also that it's so important to look at when combating an eating disorder. And we've seen it really effective we've seen it be really effective having dance movement therapy be a part of eating disorder treatment. We definitely want to express today that we feel eating disorders see no race, gender, age, sexuality, socioeconomic status, and eating disorders do not express themselves in the same way. Everyone has a right to receive support around this and look at their mind-body connection. We definitely don't believe that you have to fit a classical definition to work on body image, experiencing yourself in your body, or having a better sense of self somatically, which means physically present in your body, as well as just in the world. Just a little background on eating disorders. I find that clients do make their own food rules or set their own limitations. What can happen is these thoughts and feelings that we have affect our body, which inevitably affect our relationship and connection to our body. So you might see weight loss that affects the body's functioning, compensatory behaviors such as binging, purging, laxative use, self-harm, chew-spit behaviors, body checking, obsessively weighing oneself, or obsessively thinking about food or the presentation of the body. And some behaviors that I probably didn't list, like I said, all warrant a need to get help and explore how they affect you living in your body and connecting to your body. All organs of the body can be affected, but don't discount how the brain can be effective. And we're hoping to, work on some of the somatic sensations as well as the thoughts that come up in this work.
I think it's also important to note, as Danielle mentioned, that eating disorders can affect all of us regardless of our race. But the eating disorder field itself is rooted in a very white-dominated medical, psychological, and psychiatric system. And a lot of our knowledge is based largely on the experiences of thin, white, privileged women, as these are the folks who have had access to care when eating disorders were first identified and diagnosed in the late 1800s. And so here on this slide, you'll see some of the research around the ways in which eating disorders affect Black and brown folks. So Black teenagers are 50% more likely than white teenagers to exhibit bulimic behaviors such as binging and purging. Latinx teens were significantly more likely to suffer from bulimia than their non-Latinx peers. And Asian, Black, Latinx, and white youth all reported attempting weight loss at similar rates, while Native adolescents, 48.1% were attempting weight loss. And so there is often a perception based on just sort of societal expectations and the ways in which Black and brown folks are seen, the stereotype that they don't experience issues with body image. And as we can see from the research that's here, that is not the case. So folks of color with self-acknowledged eating and weight concerns were significantly less likely than their white participants in this study that we're quoting here to have been asked by a doctor about eating disorder symptoms, even when they presented with similar symptoms. And that's something that as a clinician, I see very frequently, that doctors don't ask and don't pick up on disordered eating behaviors in folks who don't present in the more stereotypical white body. So I think as we're talking about eating disorders, it's really important to note that that exists and that anybody can have an eating disorder regardless of shape or size or color.
Absolutely agree with that. And kind of coming back to why dance movement therapy is helpful and effective in eating disorder treatment is we will hear clients talking about hating their body all the time, self-loathing, thinking about the body constantly. So how are we not talking about the body in eating disorder treatment when that is so connected to the thoughts that come up? It's really important to heal the relationship with the body. Our body is an ever-changing vessel that is not going away. So even though the relationship and the emotions that come up around our connection to our body can change every day and will change in different phases, it's still always your body. It's how we come into this world and how we exit this world. So if you can even just start right now to start kind of reframing that thought that, some days my relationship with my body kind of quote unquote better or worse than other days, even though we don't like to engage in that black and white thinking, that it's still the relationship with the body. It's not going anywhere. We have to find a way to work with it. It really comprises and holds who we are. Our body is our home. We don't want it to be an empty place that we hate. We need to find a way to be a part of it. I believe that an exposure response prevention model can be an effective method for treating an eating disorder, and it can be applied to body-based work. So there's a lot of avoidance of fear foods, and a lot of the research on exposure therapy is about exposing yourself to that variety of food, that stimuli that could increase your anxiety. But I follow a pretty similar approach when working with the body. Just doing some of the breath work that we did at the beginning of this webinar can bring up a slew of feelings. So I do think that model can be applied to the work that we do. It is a practice. It does take time, but the more you allow yourself to be exposed to that connection, be exposed to those sensations that are coming up in your body, the more comfortable you can start to feel with your body, in the same way you're starting to get comfortable with a variety of food or nourishing yourself. I think also specifically with binge eating disorder, there's a lot of fear around having certain foods, because there's a fear that that's going to lead into a binge, or that's going to lead into a binge purge cycle if you struggle with bulimia. So the same way we're slowly exposing ourselves to those types of food and getting skills on how to regulate and normalize that relationship with food, we want to do the same process with our body. It's really important. The function of the eating disorder, as the sensations arise in our body, is to cut it off or numb it. So the more that you start to be aware of the function of the eating disorder and what's happening there, the more that you will allow your sensations to come up and start to explore why it's so difficult to experience. Memories and events that contribute to our formation are stored in the body. There's a lot of literature around that, and hopefully many people on this webinar can attest to that or might have experienced that. So Aliesha's gonna move into how we work with our body in sessions.
Thanks for that, Danielle. So yes, we're looking at the architecture of a dance movement therapy session. And, just as Danielle said, she explained a little bit about some of the benefits that DMT, as it's affectionately known, can bring into eating disorder treatment, especially in terms of reintroducing the individual, the client, to sensations that might have been numbed. So dance movement therapy, or DMT, it comes under the umbrella of the creative arts therapies, which use the expressive process to enhance well-being. So the initial reflection and experiential that we did, which really consisted in sensing the body, is a large part of how I, in particular, as a clinician, like to structure a DMT session. So for me, it's really about finding and establishing first some awareness of the body, starting with the body and really observing our reaction to our bodies in the moment, and really essentially beginning a body-based experience. So in DMT, in an actual session, I would seek to do several things. The first is kind of translating nonverbal experiences into cognitive insights. So what does that mean, right? So in a DMT session, the therapist will kind of help the mover explore and make connections between their movement and their emotions. And I feel that part of my work is to encourage the mover to track those bodily sensations as well as their breath, and to become aware of their own self-expressive potential. And this can happen through improvisational movements, for example. So then, in addition to facilitating improvisation, I might offer a specific movement or a verbal intervention that's intended to promote the healing process, like the moving forward process. And that is also intended to assist the mover process any feelings that may have been elicited by the movement itself. So the second thing I'm generally seeking to do in a session is to restore agency in the mover through self-directed movement. And I feel that this aspect is of particular importance for individuals who are struggling with eating disorders, because we often see that there is a shutdown of the individual's ability to receive and respond to internal cues, in particular hunger and satiety cues, but there are other cues as well. I think we've observed great difficulty kind of envisaging what is needed or wanted in a given moment. We often see also a belief that like the person should not exist, that they don't have the right to express their needs. There can be a self-silencing in many respects. And so I see my role as a clinician in the room to encourage the mover to reclaim their voice, to reclaim their needs and desires in actions and also in words. And we've seen repeatedly that experiencing is essential in reclaiming agency. It usually isn't enough to know something, you know, on a cognitive level, because then it just remains an idea. Instead, we actively seek to have that knowing descend down into the body so that it can be felt and experienced and then more easily accessed, and then essentially become a new way of living. The third thing that I seek to do in a session is to provide relational validation. Some of you in the audience may have heard before that DMT fosters communication, you know, between the mover and their own self, between movers in a group, or between the mover and the therapist that they're working with. And we also know that validation is one of those ways that people communicate acceptance to one another. So in the space of the dance movement therapy room, whether it's physical or virtual, in many cases, in this mutual observing and witnessing of one another, and in that creating moments of connection, the client, the mover, they're allowing themselves to be vulnerable enough to move in front of others, to be seen by others. They're opening themselves up to membership. And that's a state of belonging that we all need, really. So in terms of what a session looks like, or what's informing a session, looking at attunement, kinesthetic empathy, rhythmic synchrony, and movement metaphors. The first one, actually, I think I'll look at movement metaphor first. So with a movement metaphor, it's using symbolism to bridge the internal to the external and allowing that to serve as a vehicle for change. So this can entail the use of abstract symbols to represent something in the mover's lived experience, something that they might not be consciously aware of yet, but that we're hoping to bring into their awareness through movement. So in a session, I might introduce a symbol, for example, a shape, and the client will make meaning of that symbol. So for example, there was one occasion where a client decided to take a circle, the abstract notion of a circle. And in their movement, they started to dance in a circle. And as we did the processing later on, that client described how the circle and how their circular movement was a direct reflection of what was going on in their life, as there seemed to be an interminable cycle of events that they couldn't escape. Going on to the next thing, rhythmic synchrony. Maybe next slide. Thank you so much, Chloe. So rhythmic synchrony is something that manifests when the therapist in the room is in tune with the client's emotions. In movement, this can look, it can be as simple as like walking side by side at the same pace as the client. Attunement, on the other hand, is characterized by an aware or responsive attitude towards another person. So to be attuned to another person is really to take in the experience of the other through what is visible, such as posture or gesture, but also through what is intuited. So based on my own internal physical cues, for example. So in a session, attunement can happen through dialogue. And this is not to say that it's an easy or even a fluid dialogue. In some sessions, I find that I'll come up against attachment, dissociation, or disengagement, which are aspects that Danielle will actually talk about in greater detail as we go along. And these things can happen when any mention of the body is made. And in those situations, it becomes apparent that the body is not considered a safe enough space in which to reside. And then my work becomes more about how do we reestablish that it is okay to reside in the body. Let's see. In other situations, when the client is perhaps better able to tolerate more engaged movement, the dialogue that happens can be more in depth, and we might explore goals that the client is working on, where they are in that particular moment. And so basically what we would see in a DMT session, as I kind of mentioned before, is a direct reflection of what's happening in the life of the client. And so I can bring in movement interventions that in some way respond to those concerns. In terms of kinesthetic awareness and kinesthetic empathy, a session will include elements of both. Kinesthetic awareness is the ability to sense one's own feelings and sensations. And this is an awareness that often needs to be awakened in eating disorder clients. Kinesthetic empathy, on the other hand, is the ability to sense what others are feeling. This is kind of related to attunement in that I might use cues and signals from my own body-mind experience to gain clues, for example, as to what questions might be pertinent in the moment, what might be useful for the client to explore, and also will lead me to conceive of a movement intervention that might be useful to bring into the room. So for a more concrete example, if I'm feeling knots in my stomach while I'm speaking to a client, I might ask them if they're feeling anxiety, if the feeling is mutual, or if I notice that the client or myself is exhibiting some sort of narrowing in their bodies, like drawing in the arms or drawing in the legs, I might ask them how they're doing in terms of feeling that the space is safe enough to be vulnerable in. When we're moving together, a DMT, or me, I also like to do this, will sometimes use a technique called mirroring. And that consists in either matching or echoing a person's movements. And this is really an attempt to illustrate empathy for that individual and to provide validation for their experience. One movement-based experience that I'd kind of like to describe before passing it on is one in which we explored black and white thinking. Black and white thinking is something that we see in many of our clients who generally tend towards perfectionism, and they have a tendency to see things in extremes, right? Things are either this or they're that. And it leads to a substantial limitation of their experience. And so we actually brought in the idea of opposition and movement, and we asked the clients to name opposing sides of various spectrums. And so we came up with kind of the usual ones, like big, small, near, far, but then also more abstract concepts like love, hate, win, fail. And we started with a movement warm-up that was really designed to first bring the clients in greater contact with their own movement potential. And then we took turns exploring the breadth of possibilities between the opposites that we had named. And it was really interesting because following the movement, the clients were able to name so many possibilities that lay within the gray area. So I bring this example up to illustrate the importance of the effect that DMT can have, because again, we hear this, I know this up here, but I'm not able to live this. So through providing a relatively safe container for clients and through providing a validating space, we can see where they can see their actions mirrored in the bodies of others. And through this physical exploration, through this experiencing, they're already living greater possibilities, and they're better able to take those possibilities out into their daily lives. So one thing I'll mention, and Jennifer, I think will talk about this a little bit more, is that a lot of what I've just described can only happen when the therapist and the client are within their window of tolerance. So I'll let Jennifer take us through that.
Yeah, so your window of tolerance, when we use that phrase, we're talking about the nervous system. And part of the autonomic nervous system is something called the ventral vagal branch. And that is what we're speaking of when we mention window of tolerance. That's the space at which you feel most safe, social, and connected to your body. And you're able to connect through to other folks, verbally and non-verbally. much easier when you are within this space. Sometimes folks will describe being in their window of tolerance as feeling calm or feeling grounded. So the wording that feels best can be very individual, but in order for us to do all of the things that Aliesha mentioned in a dance movement therapy session, it's a lot easier when both the therapist and the client are regulated and moving in a regulated place. Of course, there's always the possibility that co-regulation can happen, and that as one person is more emotionally regulated, the other one can find that window, that place where we feel like we have some choice in our responses. Often the coping mechanisms that we employ when we have eating disorders, when we've experienced trauma or any of the other conditions that can occur alongside eating disorders, the coping mechanisms that feel most undesirable are often automatic. It's the nervous system's automatic response to protect us in service of our bodies, in service of our protection. And so bringing both myself as the clinician and the client or the person on the other end into the window of tolerance can help create a little more choice and more opportunity for more flexibility in response.
I totally agree with that as well. So I hope this next slide will help both clients as well as clinicians, because as we're talking about, it's helpful to have both parties, or if you're working in a group and you're working with multiple clients, everyone kind of find that space where they can be open to learn about themselves and explore this relationship with their body and gain some insights into it, and eventually, change some of those automatic responses. So to know whether you're responding in fight, flight, or freeze, I think is really helpful. And also, neurons and nerves are firing quicker than our conscious mind can keep up with. So as Jennifer said, it's the body coming in as a way to protect yourself. It's either getting, overloaded with stimuli and doesn't really know how to regulate, is the reason that you might go into one of these states. But also know it's not your fault if you react in one of these ways. It's just how your body is responding. But if we can start to open up that mind-body connection and really take the information of how our body is responding and be able to start to talk about it, it really opens up a new space between you and the clinician. So some common examples I might hear, even by just saying, "Hi, I'm Danielle, dance movement therapist, and we're going to move together today," is enough of a phrase that could elicit some of these responses. A thought such as, "Don't tell me what to do with my body," would be a sign that you would be operating in fight mode, or "I'm the only person that tells my body what to do. I'm not open to welcoming anyone else into this relationship." Usually I sense a little bit of protecting the eating disorder, and the eating disorder doesn't want to allow someone to come in to help to change up that relationship. Flight, if I introduce myself, a couple of times I'll hear clients immediately say, "I need to go to the bathroom right now." One part of me likes to think that we're just opening up sensations to our body, and maybe you didn't realize you had that need. But it's also really important to look at if you are just getting overwhelmed by the idea of connecting to the body. And, if you're doing virtual supports right now, you might find yourself on another screen on the computer, or starting to look at your phone, or just completely distracting yourself to remove yourself from the situation. A freeze response, I see the most when we start creating movements and working on movements. So in the beginning of the work of dance movement therapy, a lot of clients might just say, "I have no idea, how to move. I have no idea what you're looking for," is a little bit of a different question. But if you haven't connected to your body in a long time, if you don't allow yourself to express yourself or your emotions, even if it's just through your postures or, how you speak with your hands and how you hold your body. If all of that becomes limited, you might just find yourself in a freeze state. You don't know where to start. Or we also talked in the beginning about how it just feels like every part of your body is impossible to connect to, because there might be a lot of self-loathing there. So really being able to identify one or two parts of, okay, I'm just going to focus on the connection to my fingertips, or I'm just going to focus on the connection of my toes to the ground. There is enough in that relationship that sensations can come up just from that. And like I said in an earlier slide, it is a practice. So just kind of doing some self-touch fingertips to fingertips, kind of repeating that over time will, allow the sensations to start to come up. As we're opening up that conversation, it's also important to start to understand your why. Do you inhibit your nonverbal expression? Getting a greater understanding of why that's happening is really helpful. And the way that we work in dance movement therapy is that you're not always just talking about it. By doing some of these movement experientials and exercises with the clinician, hopefully your body can answer some of those questions or give you some points to process and get some more information where you're avoiding or where you're holding tension. But there can be a lot of self-worth thoughts connected to this. Do you feel that you're too much for people to deal with? Are you afraid that if you start expressing yourself, you're going to be rejected by others? Do you generally not feel worthy of expression? Or when you were growing up, were you punished when you did express yourself or express one of your needs? Were you meant to feel bad about that? Do you struggle with feelings of guilt? Do you have trouble tolerating how you feel in your current sense of self or identity? And that might cause you to get focused about changing your body's appearance. But there's really some nonverbal work to be done around your identity and how you connect to yourself and how you express yourself. I also want to highlight there's a spectrum of trauma that can affect how we connect to our body. And as we're saying that a body connection and body image, it definitely affects eating disorder clients, but also affects people outside of an eating disorder. So there's a range of events that could have occurred in your life that make it difficult to connect to your body. And a lot of times your body is trying to protect yourself from that fear of rejection, or being told by expressing yourself you're doing the wrong thing. I am talking about any kind of event from bullying, particularly if it was around your appearance, weight, or identity, to physical, sexual, or verbal abuse, to having a significant loss, any neglect or needs not met while you were growing up or possibly later in your life as well. Just be aware that there's a full range of trauma, and helping yourself identify what that is can really increase your understanding of why it is so hard to feel present physically, somatically. Jennifer's going to expand a little bit more on another response, which is a little bit newer, but we definitely believe in it, is a fawn response. So often a client will abandon their sense of self or identity to merge with the perceived threat in a hope to minimize harm.
Yeah, so fawning shows up a lot, tends to show up a lot in people pleasing. So if that feels resonant for you as a coping mechanism, that could be what's happening. I explore fawning pretty significantly in my work through the lens of oppression, and very strongly believe that we can't separate illness from the social context in which it exists. And so as we're exploring eating disorders, as we're exploring any of the other concerns that come up around eating disorders, I do feel as though oppression has to be part of the conversation. And that is part of one of the really important reasons why I feel bringing the body into eating disorder treatment is really important, because oppression, this is a quote from Ta-Nehisi Coates in his book, Between the World and Me. Disembodiment is a kind of terrorism, and the threat of it alters the orbit of all of our lives. And like terrorism, the distortion is intentional. And in that quote, he is speaking to the effects of oppression on the body. And so oppression itself drives a rift between the self and the body, our sense of self and our bodies. It affects our body image. And we end up, those of us in marginalized groups and marginalized bodies, fawning in the larger context of society, trying to fit into the right body or trying to have the right body. And sometimes that's not possible. Our bodies are genetically not wired to be that way, or in the context of race, it's not something that we can change. And so bringing the body into a dance movement therapy session can also address some of the larger, the social context in which we live, which I think is really important. And so here I'm defining oppression as the experience of repeated, widespread systemic injustice. And that exists within diet culture. It exists if we look into the history of fat phobia, and the wear and tear of all of the continuous oppression that we can experience on a daily basis is shown to be a catalyst for the development of post-traumatic stress disorder symptoms. And so there is research to show that even in the absence of a known traumatic event, folks who are in more marginalized bodies will present with symptoms of post-traumatic stress disorder. And some of those symptoms can be the symptoms that we see with eating disorders.
So some of the work to be done is starting to change your reactions and responses. We're going to talk about how to challenge detachment and dissociation. So putting words into figuring out how you're responding and being honest about it. One of my favorite things I hear from my clients is, I hate this work. But you know what? I really appreciate that they're being honest with me. Being honest will bring forth your authentic self in the moment. I'm not looking to connect with people in a way where they're just following along to the movements that I'm doing. I really want people to develop and customize the coping skills and the grounding work that works for them. And we do have to be honest with each other throughout the whole process, similar to what Jennifer was talking about. If you find yourself just in a fawning response the whole time, just trying to please the dance movement therapist and hear that your body connection is healed, it's likely that you're not feeling that, and it's likely that you're not there yet, or it's not going to be sustainable because it's more of just a fawning response. So being open to feedback, listening and learning, and then doing and speaking. I love that doing comes first. So starting with the body before the words can come. And Aliesha was talking about that mirroring and that kinesthetic empathy. So we're doing all of that work in a non-verbal way, and the client has to be open to feedback and our interpretations of what we feel the body might be expressing. Now, we're not saying that we're always right. There's nothing, magical. We're not magicians in this process. We can't mind read. But if the dialogue can remain open about what we're experiencing in our body, what you're experiencing in your body, how we can move through those transitions from movements that we've known our whole life to new ways of moving, we can really make a lot of changes. So you want to reason, not overthink it, but get more understanding of your response, and then relate to other people who are also responding in their own way. Aliesha and I run a group. You can do dance movement therapy individually or in a group, but one of the benefits of doing the group is it allows so many people to start contributing movements, and that can really open you to ways to regulate and different ways to express yourself. Movements that you typically wouldn't come up with in the moment because you're so used to responding in the routine way that your body functions. So to be able to work with a group really helps to open up possibilities and open up the repertoire. Definitely to be mindful of somatic sensations, where and when and how those sensations are coming up in the body, opening up all your senses, starting to be aware of smells, different textures. I am definitely a big fan of any kind of props or any kind of new textures. If you're really not understanding what could a connection to my body, what could sensations in my body actually feel like, if this is all feeling still too abstract to you, working with silly putty or different kinds of sensory balls that are out there, and different kind of textures, just even in your environment, the difference between a carpet to glass to wood floor, just making that contact with other objects can help you feel present in the moment. And then you eventually want to see, if you just bring your fingertips to your fingertips and then your palm to your palm and then your wrist to your wrist, are you able to start feeling those connections one at a time? As Aliesha kind of reviewed, and I really support making meaning of this work, using metaphors, using art, furthering your movement or choreography. Let the body tell you what's going on when you're having trouble figuring it out cognitively, and really find out what grounding means to you. It's not the same for everybody. Some more concepts that I have here is practicing self-care and self-soothing. This might feel like radical acceptance, but just opening up the idea of being nice to your body can help heal the connection and association to fear. I do think that eating disorders are a fear-based disorder. There's a lot of anxieties and phobias and depression that are being worked on simultaneously with the relationship to food. Again, this might feel like radical acceptance is a place to start, but being able to appreciate any parts of your body. You don't have to accept your whole body to be in a place of body acceptance. You can be just really grateful for your hands and feet or the top of your head. And then also looking at forgiveness. Are you able to, do you have to, make amends with your relationship to your body in order for you to move forward with it? Your body and mind can and are very resilient, but sometimes there's a process of letting go the way that you have been relating to your body. Any type of self-talk, recognizing your body for what it is actually doing, how your body's moving through space, the speed that your body's moving at, the shapes that your body are creating, really starting to develop all of those objective relationships to your body can start to tear away at the subjective negative self-thought that you might experience, and really opening up the repertoire to the different ways you can move your body, what it's actually doing. I've been touching upon self-touch, progressive relaxation, body scans. Similar to meditation, give it time, don't give up on it, and let the emotions arise. Jen's going to talk about tracking that.
Yeah. I also want to throw in here, since we mentioned the window of tolerance and have touched a little bit on the nervous system and nervous system regulation. Part of the work can also be tracking activation in the body. I tend to get really deep into the nervous system with the folks that I work with, and really talk about nervous system states and how they affect our, not only the sensations that we're feeling in our body, but also the thoughts and the behaviors that come out of that. And so if we're able to track the activation or track what's happening in our bodies and notice what's there, sometimes we can catch things before they escalate or before we get to the point of enacting that undesirable behavior or the more strategic coping mechanism. So that might look like if you're someone who tends to be a little more anxious, right, to notice what happens in your body when you start to feel really anxious. Do you start to feel hot, or do you start to feel trembling or shaking? And noticing at the closer to the beginning of that, before things escalate to a point where you feel really dysregulated and out of control, if we can notice in the beginning what that experience is like, and then invite some of the coping mechanisms that Danielle has mentioned, then perhaps we can change the trajectory of the response. So rather than moving into the more automatic nervous system response, we're able to shift into something that feels a little more desirable. And that can be part of the dance movement therapy process, is helping you get to know your body and also developing more body-based resources for coping, in addition to some of the more external things that we tend to use.
Again, I totally agree with you. Yes. Another point I just wanted to bring up, are you repeating the cycle of generational trauma? So again, we're looking at the spectrum of trauma here, even, if we're talking about, people that you grew up with or raised you who spoke negatively about their body or always felt they needed to change their body or control what they ate or didn't eat. Did that happen in the generation before them and also before them? So this is really hard work, as I said in the beginning, and your body might respond to that new stimuli or to those feelings of fear that, you either want to get out of here, you're frozen, or don't tell me what to do. But it can be a really empowering and strong moment when you start to gain that insight that you're actually breaking generational trauma, and you're going to make it different for whoever you invite into your life, or bring into this life as you start to heal the relationship to your body. So are you repeating the cycle, or are you breaking the chain? It's something to be mindful of, why you are holding yourself back from freeing yourself, from expressing yourself through your body, or allowing yourself to be in your body. You have that right. We wanted to close with a movement exploration. You want to jump in there, Jennifer?
I can do that, absolutely. So one of the movement explorations that I often use in session, and I find translates really well into this virtual space, is inviting folks to express how they're feeling using their bodies. And so for those of you watching, this is something that you might explore on your own, and also Danielle and Aliesha and I will explore it here. And so asking, right, if you were to demonstrate how you're feeling in your body right now, or how you're feeling about exploring this concept of dance movement therapy, this therapeutic modality that exists, how might you express that? And I tend to stick in the beginning to more like hand gestures, because those, for folks that are capable, seem to be something that's more easily accessible, or even facial expressions. So for myself, if I were to explore how I'm feeling about moving or how I'm feeling in this moment, I might shake my hands in this way. Yeah. And so within a session, I might also have the other folks who are in the room do the same thing. So Aliesha and Danielle, if you want to move with me, you're welcome to. And those of you who are watching, you're welcome to move as well. And just noticing for yourself how that movement feels, right? Does that bring up any feelings, sensations, thoughts for you? And you can pause whenever you like. And we can pass that around. So I would also ask Danielle, if you were to express using your body, how you're feeling right now, what might that look like? And so we all do it together if that feels good. And maybe as you're doing this, this resonates with you in some way, even just noticing the way it feels for your hand to hit your other hand, or noticing the sound. Does that feel resonant about your own relationship with your body, or how it might feel to explore moving? And again, you can stop whenever you'd like. And you can also modify any of these movements if you're doing them with us. Yeah. Aliesha, what about you?
Do we have time for a transition to a larger space? I feel like doing a more full body movement. Yeah.
Perhaps.
Yeah, we do.
I'll just take 2 seconds to switch into a different space. I'll be standing.
Okay. And I also, while Aliesha is shifting, I want to note that dance movement therapy can be really expressive, big gestural movement. We can also explore more somatic sensations and things like that. So it's not always the big expressive movement that you see. But I'm really happy that Aliesha is going to do something bigger for us to explore.
Okay, so the prompt was how I'm feeling in my body in this moment.
How are you feeling in your body in this moment?
Okay. Okay.
And so
That's
I
how
would ask you, Aliesha, thank you for sharing. How did it feel to move in that way? What did you notice in your body, or your relationship with your body as you're moving?
I think a big part of it was that I was responding to what had come before. I noticed that I was feeling a bit restless. I noticed that I needed to stand up. I noticed that I needed to stretch. But then I think I'm also taking into account this moment of the three of us kind of reaching out to people out there. And so I think I was expressing that desire to reach out, and just the action of reaching out.
That's really beautiful. Yeah, there was a lot of reaching of the arms, and this movement that you were doing toward the end really resonated with me as something that I might do in my own body. Yeah.
I think actually if we sequence them together, it also highlights when you're working in a group how, you know, you are bringing to the table and you are being vulnerable and honest about how you are connecting to your body. But then we're also piecing some movements together so that you can be open to other people's movements, and you can find transitions of how to move out of that state. So if your connection to your body, you know, always creates a nonverbal expression of, you know, high anxiety, tension, anger, fear, you know, by opening it up to incorporating other people's movements in a transitional phase, it helps teach you how to get out of that and how to break that initial connection if you guys are open to putting them together.
Yeah, I think that's a really great idea too, because somebody popped in the chat that they couldn't actually see Aliesha. So putting them together.
Should we try
could be,
that?
yeah.
Okay,
a
I'll
really great way
transition
to
back.
explain. And so, Chloe, I don't know if you have a trick for making sure that everybody is seen. Being seen is also part of the dance movement therapy process. So folks can see everyone as they're moving. That would be really awesome.
Great question. You should be able to adjust your view. So up in the upper right-hand corner of your screen, you should be able to see something that says view, and you might be able to change it from speaker to gallery of all panelists. And if you're able to do that, you should be able to see everybody. Otherwise, if whoever is going to move could say something, they'll become the speaker and should have the largest screen. So.
Gotcha. Okay.
Thanks, Chloe.
All right, so we're starting with the movement that I shared and then moving into Danielle's movement and then Aliesha's. And for those of you that are here with us, you're welcome to move with us in whatever way feels good and safe and right for you. And then we can take it from there. Chloe, I'm seeing that the webinar host needs to put it on gallery view so that we can be seen. Can we? Thank you for hanging in there with us as we try to make that a possibility.
Okay.
I'm not sure how to add that, but I mean, it is also common that we add sound to our movement. So maybe we should try to add sound so that we come into the speaker box.
Yeah, all righty.
Okay.
So saying our name or saying something as we're moving.
Yeah, I don't see that. I don't see that setting.
Okay. We'll try and make it work. Hopefully you will be able to see us all as we add some sound when we're moving. So I will start with mine, which was hands moving back and forth. And pass to Danielle.
Boom, 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 Aliesha.
So I don't remember exactly what I did before. I'm just kind of responding to the moment. I remember that I wanted to reach out to the audience and gather everyone in. And I pass it back to Jennifer.
All right. So for those of you that were watching, I hope you're able to see. And if it makes sense for you to just pop into the chat, if you did it with us, what you noticed in your own body, if you were watching it, is there anything that came up for you as you were watching? And I will say that for myself, in moving, I went from having a somewhat more frantic experience, a little more kind of anxious experience in the beginning, being able to express sound with Danielle helped me to kind of vocally discharge some of that activation. And then there was a lot of really open movement with Aliesha that invited a little more space in my body than what was there before, which I thought was really, for me, very grounding and supportive of coming back into my window of tolerance, that lovely space that we mentioned earlier. And I'm seeing that some folks in the chat followed along as well. Eleni, I hope I'm saying your name correctly, said they followed along and loved the sound of arms and fluidity with Aliesha's. Yeah, Karen felt sensations in each movement, all felt freeing. Awesome. And so that's just a little taste of some of the things that we explore in a dance movement therapy session. When we're working with eating disorders, oftentimes when we're working with other conditions, we will use some of the same approaches and methodologies as well. So hopefully you have a more body-based idea of some of the work that we do, as well as some of the more theoretical frameworks around the work that we do and the things that we explore, from the nervous system to trauma to oppression. All of those things are invited into the session, and things that we try to help you move through in the process of healing and recovery.
Absolutely. I think a lot of times we don't even realize how much we are limiting our connection to ourselves, our experience in ourselves, and our expression until we're in that platform or that space with a clinician that's kind of like pushing us up into that edge. We want to rub into the discomfort to know that we're getting closer to change. And you also reminded me, Jennifer, of something I wanted to say around the different ways that the trauma can be stored in the body. There is a certain level of discharge that needs to happen to reorganize and integrate those memories. So we're here to help you find a safe way of discharging those emotions and memories and recalibrating in a new way through your body. So not only we're expressing through the body, we are also learning how to be with our body, in our body.
Yeah, and I want to address one of the comments in the chat as you're mentioning that too, Danielle, is that it can be really uncomfortable to be in the body. And so I think for all of us as dance movement therapists, we do come into sessions with that understanding. If we're working with eating disorders, if we're working with racial trauma, and you're bringing all of that with you in your body, all of those things stored in your body in session, sometimes it can be really uncomfortable to be present in this container that we have, the body as a container. And so if you were feeling uncomfortable exploring in your own body as we were moving, I want to validate that experience for you and also normalize that, as the world in which we live very much prioritizes cognitive processing and verbal expression. And so even as young children, we're often told to use our words. And so expressing ourselves in our body, although it's something that we come into this world doing, is not always comfortable as we start to move through the world and the various systems and structures that exist that tell us that it's not okay to be there. And so part of the exploration, or part of the process of being in a dance movement therapy session, is working with some of that discomfort and perhaps getting to a place where it feels safer to explore. But I do want to say that it's totally valid and totally normal.
Definitely. Any other questions that we want to address now before we go into the next slide?
I think that was all that I saw in relation to the movement piece, so you can move on.
Yeah, we have just a couple slides left. So if you are having questions starting to come into your mind, feel free to put those in. We'll be moving to questions shortly. So what can be helpful in this work, as Jennifer said, it can be really uncomfortable, and that's normal. And it's really hard to do on your own. So allowing yourself to be in a group or a community with other people that have also struggled, regardless of how similar or different, that you can have a community where you can feel safe enough. We can never guarantee complete safety, but safe enough to start expressing yourself and change your relationship to your body, we strongly believe in that and also want to be able to provide that. Just in eating disorder recovery in general, there's so many changes that are made, and sometimes our family can't keep up with it or our culture challenges it. So develop an anti-diet, holistic, empowering, self-respecting community. It's only going to help give you more and more courage to connect to your body, rub against those difficult or uncomfortable feelings. In the end, you can get a lot of empowerment and freedom that can feel really good. What we're looking to do is help you learn how to respond to your needs and express yourself, both verbally and non-verbally, how to practice what is best for you rather than what you think is expected of you. I tell my clients all the time that they do not need to do the movements exactly like me. If someone modifies because that's what their body's telling them, I'm so proud of them. If they're reincorporating movement into their recovery and they're experimenting with a dance class and it ends up being more triggering than not, and they decide to walk out of that class, I am so proud of them. So just allowing yourself to be seen, eventually supported by your peers, can be really helpful. To have that kind of in your back pocket when you're out in the world, I think really helps. Allow yourself to learn new movements by seeing how others explore their space, but also being vulnerable enough to share your own. Improve your relationship to yourself as well as others. Just a little bit what we have going on at Balance. So we do have virtual outpatient groups. We have outpatient individual supports, whether that's one-to-one therapy, nutrition counseling, meal supports. And we also have our 3 main programs: a day treatment program, an evening program that is 3 nights a week, and a Saturday program that can be done at standalone or in addition to the day or weeknight program, depending on your clinical need or support. If you have questions about what you learned today, or you just want to talk to an admissions therapist to learn more about how you can connect to your body or set up sessions that will help further explore this relationship, we're happy to do this. And also, if you're questioning whether you have an eating disorder, a poor relationship with food right now, or a poor relationship with your body, we're here to help you figure out what you could be struggling with and the best way to get some help and support around that. All right.
Okay. Well, thank you all for that wonderful presentation. I found it to be very informative and helpful, and I hope all of our guests did as well. Just like Danielle said, if anyone is interested in learning more about the groups, the programs, or nutrition counseling that we have at Balance, please feel free to visit our website, or you can just go right to this link or call us at the phone number listed. I'll also drop that in the chat in case that's an easier way to see it while our presenters answer some questions. So if everyone is ready, we can move into some questions that we got from our guests tonight. All right, so the first question is, since this is a practice and a skill that needs to be worked on over time, what are some examples of practices or exercises that clients can take home to improve their connection with their body?
I can start it. We can all kind of pass it around.
Yeah, that works.
So definitely breathing and breath work, I think, is going to be on the top of all of our list, because it's not only, we consider it an exercise. It's not only an exercise you can do no matter where you are, whether you're in the grocery store, whether you're at your home, or you're traveling. Just practicing your breath work and noting if and when physical sensations can come up is definitely the first place I recommend you to start. From there, like I said, that everyone's grounding experience can be a little different. I encourage you to start developing your own movement warm-up. And the best way to do that is just to start experimenting with body parts kind of one at a time. Like, what's a movement I can do with my hands that makes me feel present, gets me kind of out of my thoughts and literally into the movement that I'm doing. And that kind of objective language would be, the self-talk is, I'm moving my hands in a circle. I'm moving my hands in a circle. Not judgment on that, just literally saying what the hands are doing. And then you can expand that into other parts. Now I'm gonna do something with my elbow, do something with my hip, my knee, my foot. Some will be, I think, traditional exercises or stretches that you've known throughout your life that are not associated with the eating disorder, that do comfort and ground you. And hopefully there would be some new movements in there as well. The last thing I want to say is you then start to connect that breath work to the movement. So you can start associating to it differently. Clients have told me just by doing movements they've done all their life with the breath work is a completely different experience. And that might become part of your movement warm up.
Yeah, go ahead, Aliesha.
Oh, thanks, Jennifer. I was just going to say that I agree with Danielle in the sense that taking breath work with you is really important. So you can even take the exercise that we did at the beginning of this webinar, which is kind of like a slowing of the inhalation and the exhalation, breathing in on 3 and exhaling on 6, making sure all the air is expelled. Again, making sure that the feet are flat on the ground and that the palms of the hands are on the thighs. All of this will ensure grounding if that's something that you need in the moment. And then another thing I would emphasize, and this is something that Danielle touched on earlier, is just the use of self-touch. And so something that I could offer even in this moment that can be grounding and also a way of showing yourself self-compassion is, for example, to pretend that you're putting on long gloves, the longest gloves in the world, and just feeling as if you're putting the gloves on the body and allowing the hands to massage all the way up and feeling like the gloves are coming around towards the back, and then just doing it on the other side. And then if you want to go even further, you can pretend you're putting on the longest boots in the world, right, and just reach over. And again, that same massage, that same compassionate touch along the legs. So those are things I would offer.
Yeah, I tend not to start with the breath. Maybe I'm a little strange. But I do find sometimes clients can be really triggered by paying attention to their breath. And so it's not always a starting place. For me, I do incorporate it later on. In the beginning, I tend to start more with rhythm and finding a song that has a rhythm that you like and just starting the movement exploration from there. A few minutes of like an in-home dance party or something, or finding movement that you already enjoy and incorporating that as a practice, as something that you do for a few minutes every day, or something that you're really intentional about doing. But rhythm is something that I do tend to start with, and then later on we'll find ways to explore how that rhythm can be connected to the breath, how that rhythm sometimes disconnects from the breath when we move outside of that window of tolerance, when we're feeling more anxious or in that fight or flight space, or when we're in that more depressive place, what happens in those places. But I do think it is a valuable resource. And when we're talking about rhythm, something I often will bring attention to at some point is the rhythm of the heartbeat, because that's something that kind of follows us. And also recognize that can also be, depending on who you are and what's happening for you. The gateway in can be very different. And so taking what works and applying it in ways that feel good and safe and right for you. But the things that we would recommend are all pretty individual when it comes to the folks that we work with, for sure.
Thank you so much. A question came in from a couple of different people asking, can dance movement therapy be useful? Can dance movement therapy be useful for those who are already aware of their body movement, such as dancers and gymnasts with eating disorders?
Yeah. Yeah, I think having been a dancer for many years myself, dance movement therapy has made me aware of my body in a very different way. And it can be really interesting to explore the relationship between more structured dance and more expressive movement, or even the sort of precursors to the more expressive movement. So what comes before that tends to be sensation and the more somatic exploration in the body. So we can really dive into nervous system responses and impulses and that sort of thing that are often things that aren't explored in the same way when we're talking about a dance class or choreographed movement and like gymnastics type movement or even yoga. So there can be a deeper exploration that can occur with that, I find. Danielle, do you have anything to add there?
Yeah, I totally agree. I mean, sometimes I think it can actually be harder to figure out how to change that connection because like Jennifer said, unless you were trained in improvisation, almost every other dance style is telling you how to hold your body and how to move. So to really, and gymnastics would be the same thing, certain way to perform and a certain way to construct your body to get more points. So honestly, sometimes it can be a harder connection to kind of break and mix all of that up and actually find out what your body needs or wants to do. So I would definitely recommend it.
Yeah, I'm actually really glad that Jennifer brought in her personal experience because I find that my own was quite similar. I was trained in various techniques and I found that my body was actually quite rigid because I was used to moving in very specific ways depending on what technique I was doing at a given time. And so I actually found that with DMT and greater awareness of my body, I was able to change the relationship to my body. And again, it was that deeper exploration that I was looking for as opposed to focusing on aesthetics. It was really about my relationship to myself and the people around me.
Yeah, and often I find too, as dancers, we can get into a place where a lot of the movement we can do on autopilot. And so in dance therapy, there is a much more focus on really connecting to the body as we are doing the movement. And so a little less, like Danielle mentioned, the performance aspect, but also rather than sort of dissociating or disconnecting from ourselves as we're moving and going to that autopilot space, being very aware of our own body posture and everything that's happening for us.
Thank you so much. And I think we have time for probably just one more question. So one that came in is, any tips for dance movement therapy working in the virtual space? So I know we have some providers and also some people in recovery from their own eating disorders on this call. So I'm hoping we can maybe get a perspective for both types of people.
I can go. Okay, go ahead.
Go ahead.
You got one? It's not
actually,
easy.
Yeah, I actually really love the virtual space and started in the virtual space about 12 years ago. And so I find that a lot of the work can be translated into this space. Sometimes the connection piece can feel a little harder because there is this sort of technology between the movers, between, you know, the therapist and the client, or two, you know, people moving in general. One of the things that I really like to do, if there are multiple people in the room, in the virtual room, is to pass the movement. I find it really helps to connect and adds like a playful aspect to things. So start with a movement, pass to someone else, and then kind of add on the way that we did earlier. It becomes this really fun game of like movement memory. Can you remember the movement of the person that came before you, and can we all do it together? And I often bring rhythm into that, right? Can we not only just imitate the movement itself, but can we notice the rhythm that in which the other person is moving? And that provides another point of connection. And so that's something that I tend to use a lot. And I also bring in music quite a bit, and just moving to different types of music, finding music that expresses parts of my personality or parts of the other movers' personalities so that we can move together and explore in that way too, I also find helpful.
I think when leading in a group, I try to emphasize for the clients, because we are doing so much therapeutic work over Zoom right now during COVID, that this is a group where I'm encouraging you to take your gaze off of the computer and just further reinforcing that you don't have to do the movement exactly like I'm doing it. I'm not going to speak for all dance therapists. I love floor work, which is something that I've had to modify a lot over virtual, because the last thing I want is for clients to be kind of picking up their head a lot to kind of see what I'm doing. So I've done a lot more seated or standing work than floor work. I know Aliesha and I did one group where we did translate it, maybe some of it using the wall behind us, so that, or we're using a chair more frequently. So you are still having that tactile connection to the wall or the chair, when usually in person it would be the floor. And I think that's been helpful. I also, even when I lead movement myself, or I'm encouraging clients to lead movements, to even kind of turn their body to the side, or it just in a different direction than how we're looking right now, can encourage them to be more aware of the space that they're in and how their body's moving through space, versus being so zoned into kind of a tunnel vision.
I would just add one more thing. I definitely agree with what both Jennifer and Danielle have said. This is actually all I've ever known. You know, being an intern, I actually have started working in the virtual space, so I don't know what it is to work in person. But I do find that, yes, it is maybe a little bit more difficult or just different to forge a connection between people who are moving together, but it's not impossible. And I find that if you make a real concerted effort to remind people of who they're moving with, really focus on who's in the space with you, and just allow that seeing of each person to happen, then I think that that helps. But I also just try to take advantage of the medium that we're in, and knowing that sound travels really well, and that our voice is something that is often not really emphasized, but the voice is still part of the body. And especially with the clients that we work with, who might have difficulty taking up space, or have difficulty speaking up, or using the voice at all, or in different ways, that's something that I like to work with a lot.
Right. Thank you all so much for answering those questions. We're just about out of time, so I want to say a big thank you to everyone who attended this evening, and of course to the three of you, Danielle, Aliesha, and Jennifer, for this fantastic presentation. And again, if anyone's interested in getting in touch with us at Balance, please feel free to go to the link on the screen now, or give us a call. And thanks again for your participation. We're hoping to see you again for a future webinar. Have a great night.
Thanks for
Thank you so
moderating,
much.
Chloe.
Thank you.